Hello, everyone. I am Vanessa Cartagena, Meetings and Events Associate here at America's Essential Hospitals. Thank you for joining us today, and welcome to today's webinar, part of our COVID-19 webinar series, Effective Fundraising Strategies in the COVID-19 Era. Before we start, I want to recommend you use the dial-in number displayed on your screen to listen to today's presentation. Because COVID-19 is causing high internet usage, you might experience interruptions if you try to stream the audio portion of this webinar on your computer. So to ensure a trouble-free experience, we recommend you use the dial-in number for audio as you watch the presentation on your device. Also, like many of you, all of us here are working remotely. So please bear with us as we adjust to the challenges of producing a webinar from multiple locations. I wanted to take a moment to point out the webinar section of our website at essentialhospitals.org. You'll find upcoming and recorded webinars under the Education tab of our website. Once there, look for the webinars link in the menu just under the photo. And as a reminder, you have full access to the rich library of recorded webinars on our site. Today's webinar is being recorded and will be available on our website by the end of the week. Today's slide deck is also available for download on our webinar page. To ensure you can interact with us today, please make sure you have selected both the participant and chat tabs on the right-hand side of your screen. Although your line is currently muted, we can open it if you have a question for our presenters during the Q&A portion of today's call. If you want to ask a question, please use the Raise Your Hand feature at the bottom of your participant panel. We will unmute your line and announce you by name. Now, I am very pleased to introduce today's lineup of speakers. They include a member of our staff here at America's Essential Hospitals, Ashley McMaster, Vice President of Membership and Development. We're also excited to have a few guest speakers from our member hospitals join us today. From Niemand Collaborative, Ame Hellman, Vice President of Strategic Philanthropy, and from Valleywise Health Foundation, Nate Lowry, Chief Executive Officer, and from Valleywise Health, Lisa Hartsock, Foundation Relations Executive. Now I will turn the call over to Ashley, who will kick off our presentation today.
All right, hello, and thank you everyone for joining us. All of us at America's Essential Hospitals want to say thank you. We're just grateful for each and every member of your hospital staff and want to say thank you for your commitment and sacrifice in the face of this deadly pandemic. I think we need to go to the next slide. And one more. I want to go over some of the resources that we have here at America's Essential Hospitals. So next slide. We're here to support you now more than ever and to be the voice for equity and effective healthcare, securing funding, disseminating best practices and innovations, and facilitating member-to-member knowledge transfer. You'll hear from us in a number of ways, many of which you're used to, including our newsline articles, latest from action, updates on policy, and our action alerts to spur legislative activity. We've also developed some new communication channels specific to COVID-19. These include our weekly COVID-19 updates, which come out on Fridays. These include links to policy updates, news resources, members that are featured in the news, and our upcoming webinars and calls. This COVID-19 webinar series is another example. We'll be taking a week off next week, but we are back on June 24th. I'd also invite our members to join our email listserv. Next slide. We encourage you to go to the link on the slides listed here and sign up for our email list to continue the discussion and to share resources amongst your peers and with AEH staff. Next slide. For the resource page, you can click the link and it leads you to the resource page where you see federal, state, nonprofit, and member policies, tools, and other resources on a number of topics. These include financing, care for specific health populations, and infection control. You can also submit a resource to share with your fellow members. It's a way to keep the discussion going and to be able to have real-time back and forth with AEH staff as well as peer organizations. And next. So I'll cover some COVID-19 updates for today's webinar. Then Ame Hellman of Niemand Collaborative will talk about the importance of major gifts, and Nate Lowry and Lisa Hardstock will present on their fundraising strategies at Valleywise Health Foundation and how they had to change in a largely virtual landscape. We'll leave time at the end of the call for you to share your experiences and to ask questions of our speakers. Next. So let's take a look at the situational update on COVID-19 and what we're tracking as an organization. As of yesterday, the CDC reports 1.96 million cases and more than 110 deaths in the U.S. As we think about the impact of COVID-19 has had on our hospitals, we're reminded that hospitalizations disproportionately impact low-income communities and minorities, with reports of Black, Latino, Asian, and Native American populations dying at a rate of 2 to 3.5 times that of white populations. Situated in dense areas and serving majority and minority populations, the uninsured, and those on Medicaid and Medicare, our hospitals continue to be central to critical to combating the disparities in COVID-19 infections and deaths. Next. So looking at the financial impact of COVID-19 on our essential hospitals, there's a significant impact of COVID-19 treatment for all providers, but especially for essential hospitals whose margins on a normal day average about 2.5% compared to 7.6% for all U.S. hospitals. To maintain capacity, hospitals converted floors to serve COVID patients, eliminated or reduced their elective surgeries, and increased purchases of PPE to limit exposure risk to patients and to staff. The service changes resulted in dramatic revenue losses of $1 million or more per day. Legislature for emergency aid allotted hospital funding to cover expenses and lost revenue, but initial allocations disadvantaged essential hospitals. Throughout the year, America's Essential Hospitals advocated to secure funding and preserve equitable distribution to our members. We appreciated the announcement yesterday of an additional $10 billion in funding for hospitals that provide safety net care, as well as a future allocation of $10 billion for providers in COVID-19 hotspots. We continue to work on this type of legislation. We also recognize that our hospitals rely on multiple funding streams to support their ongoing work to provide equitable and effective health and health care to all, including the most vulnerable. Today's webinar will offer some insights on expanding the work of the nonprofits and foundations whose development activities further the work and the missions of our essential hospitals. So with that, I'd like to hand it over to our first presenter, Ame Hellman of Niemand Collaborative.
Thank you so much. I first want to thank everyone for their hard work during this challenging time. I know that most of you have probably participated in a lot of webinars lately. They seem to be everywhere, and I'm glad that you're joining this call because I hope that you can take away from our presentation a little bit of information about why major gift fundraising matters more now than ever. Major gift fundraising has been a big part of my career in-house at charitable organizations, and COVID-19 has just really hit home and made me realize even that major gift donors are such an important part of the philanthropic pie. So I thought that today we'd start at a really high level. We're so lucky in the U.S. to have AFP and Giving USA reports because philanthropy is, the U.S. really is the backbone of philanthropy in the world. We have a lot of great resources that help us look at the data. And as you fundraise, people think that fundraising is all fun and games, but it truly is very scientific and data-driven. And what USA Giving does for us on an annual basis, it gives us an overview of sources of giving, amounts received by types of organizations, and most importantly, how much was given in a given year. So I threw in the 2018 slides for this presentation, and in 2018, our total contributions were $427 billion, which is really impressive. Next slide, I'm sorry. Are we moving along? So the next slide, which shows us the 4 big buckets of revenue that represent philanthropic giving, also reflects, really where those contributions land. And as you can see, 68% of the contributions are made by individuals. 10% of those contributions were directed to healthcare, which is really great. Just for comparison, about 29% went to religious causes, 14% went to education, and only 3% went to environment and animals, which is what my career was based in. So healthcare does receive a decent chunk of the revenue, and when you look at this slide, you'll see that, individuals are definitely where it's at. Now that captures all individual gifts, so from a $10 gift to a $1 billion gift, but it still shows us that individuals are a really big and important piece of the equation. This next slide, the slide that shows the stock market index, Standard & Poor's index compared to philanthropy, also gives us a snapshot as to how the strength of the stock market really does indicate giving for individuals. And it's interesting, especially during these economic downturn times, because the strength of the stock market has eluded me, frankly, but it does represent high net worth individuals that are going to likely be far more able to support philanthropic causes. So it's a great indicator and has been for the last 50 years, really, in terms of how donors support organizations. Next slide. So today's topic, why should we focus on major gifts? This is really, these are the top elements of major gift fundraising that I always like to focus on when I talk about how important it is. When you think about your revenue channels and your budget, really the top 10% of your file of individual donors is likely going to make up 90% of that individual donor budget. So it does make logical sense to focus on those folks and other prospects like them as you work towards meeting and growing your annual budget. It's also true that organizations who rely on major donors are more financially sustainable. This has been proven over and over again, and it's just another indication that it's very important for you to put your energy into fundraising for major gift donors. And it follows that cultivating a $25,000 or greater gift, I mean, that's the definition that I use. You could use $10,000 or greater, $25,000 or $100,000 over 3 years is a really great metric. But if you work on a $25,000 gift or greater, it's going to take far less time than other tactics that you might employ that you and your team may lean into. And, a lot of your teams are probably very small. So this would also require that your executive director, your chief philanthropy officer, and senior leadership focus on those top donors to the foundation or the organization. Individual fundraising is really just very donor-driven and or what we call donor-centric. And so the outcome of that is that it connects you with philanthropists who care deeply about your impact. These are people who really get you. They appreciate your work. They appreciate your contribution to the community. And they want to give to you because they want to make a difference and feel connected to your organization and feel really proud about the contribution that they're making to, in your case, the healthcare system that they love or that they've been affected by. There's not a whole lot of, there's not a ton of data yet, but most of the feedback that I've been getting from other organizations and from AFP seems to show that post-COVID-19 trends are once again indicating that major donors are stepping up, while annual fund donors are, and those are, the smaller gifts that we receive, are feeling the economic pinch and stepping back a little bit. So organizations that rely on direct mail, annual giving through events, those types of tactics are likely, and again, this has not been proven. We need to get through the year to see how it really plays out, but they're likely going to feel the pinch a little bit more so than organizations that rely on these larger gifts and donors that support them. Next slide. So again, at a very high level, why would you want to focus on major gifts? A major gift donor is going to require relationship management, meaning that someone in your organization is going to need to be in charge or responsible for that donor's strategy, and that will, help you build a better team environment across your organization. It's going to require that you identify and cultivate and solicit individuals that care most about your mission and impact. Most importantly, in my mind, it's going to lead to lifelong relationships, most likely, that will help you all receive ongoing organizational support. Fundraising is all about relationships. So if you work closely with major gift donors and you establish lifelong relationships, they are likely to stick with you through thick and thin. It's going to help your staff be more strategic and focused in their work as you build these technically called moves management teams or relationship management teams that involve executive leadership, potentially from the hospital, your board, and your own program or fundraising staffs. And history has really shown, all the way back to 9/11, which was a time that I was fundraising heavily. It's shown that organizations who communicate in personal ways with their existing major gift donors and funders tend to raise as much or even more money than they did prior to the economic downturns, which sounds hugely counterintuitive, but major donors can be much more empathetic to their top charities during economic downturns. And if they really value your work and they understand how important your impact is and they have close personal relationships with you, you will undoubtedly raise at least as much or maybe even more money for your cause. So next slide. I love this slide so much because it really demonstrates the paradigm between sort of annual fundraising and what most organizations do and the things that you have to be aware of when you work with major gift donors. They all want to solve a problem. That's really at the heart of it. But charities tend to want to talk to the donor about themselves. They want to tell the donor about their mission and why they need money and why the sense of urgency is so important right now and why they think that their organization is better than another organization. But the major gift donor and really all donors really just want to know that they made a gift to you and you achieved something with their money. And they want to know that they made a good decision to support you and that they value, that you value their work and that you think they're special. So I think that this is just a really great slide that crosses across all sectors, organizations, and foundations. And it's really thrown in here by me as a reminder that you should talk less about yourself and talk more about the people that are supporting you. In the long run, it's going to be much better and a much better way to communicate with your donor base. And finally, I just wanted to throw in a short case study. I'm so glad that Nate and Lisa are joining us today because it's always good to hear from the field and good to ground truth these concepts and really show how they work. This little case study is soon after I became a consultant, I was very fortunate to work with the Salinas Valley Memorial Hospital Foundation in Monterey County in California. Next slide. And Salinas had a wonderful chief philanthropy officer who we had worked with, Niemand Collaborative had worked with her and her team for almost 2 years, I think, but she was moving on to a larger hospital foundation in another state, and she convinced me to take on an interim leadership role with her small team. It's a team of about 8, and so I stepped in midstream, and we were thinking at the time about doing a capital campaign, but it also provided a great opportunity for us to develop a philanthropy plan that helped us pivot from a very strong event-based culture to a major gift culture. We did end up launching the capital campaign, even though we didn't have a formal chief philanthropy officer, and I wasn't on site. I went out every month, but we pulled together a capital campaign, and we worked with the hospital CEO to recruit a new chief philanthropy officer for the foundation during that 6-month period. But the main takeaway from this is that we literally went from about 12 events a year to 2, maybe 3. I think the entire time I was there, we participated in about 2 events. But we actually increased our revenue during that time period by over 350%, basically a 6-month time period. Our campaign goal was for an expansion to the hospital, and we set a goal of $3.2 million, thinking that was ambitious, but we hit our campaign goal in such a short period of time that actually, in retrospect, I wish that we'd set a higher goal, but it was just a very, very focused and successful campaign. So really a great success. Next slide. So as you're thinking about major gift fundraising, you know, these campaigns can be a great tactic for you to use to focus on who your best prospects are coming out of the block. And in Salinas's case, we had a pretty strong file of about 4,000 individual donors. We had done a wealth screen, and we had really strong personal knowledge around who the best donors were. And when I say the best, the donors that could be the most generous in the context of a campaign. And so we identified 25 to 50 donors that were going to be our top donors for this campaign. We had good knowledge of their estimated wealth and prior philanthropic giving. We had great knowledge of their prior giving to the foundation. And most importantly, we had great relationships with those top donors that, you know, that really went directly to our board and to our leadership at the hospital. So we were in a good position to run this campaign, and we did enough research as well to track their records of giving to similar causes, which was very, very important. One of the things, though, that we did that was new to the foundation was we developed tight donor strategies and used a clear moves management mapping and system with other natural partners of influence in the process, and that was very, very important. We had not really employed in the past matching challenge concept, and so we decided to, you know, go after one large gift of $1.5 million and turn that into a batch, and that really helped us get over the finish line. Next slide. So the campaign for the expansion of the Health and Wellness Center was such a success. It served as a catalyst to help us develop a great message. We were able to partner with our high net worth prospects and existing donors. We engaged new voices and helped activate some of the board members that hadn't really been involved in the past. And most importantly, we developed a really efficient development and fundraising process through, you know, that mapped back to our philanthropy plan and through moves management really set us up for support. again, I think we set a reasonable campaign goal. I wish it had been a tad bit higher in retrospect, but it was reasonable and we hit it, and it's always better to reach your goal than not to. So we were able, even in that short period of time, to host an event. It wasn't a fundraising event. It felt like a gala, but it was actually a stewardship event, and we were able to thank all of the donors who supported us during the campaign. Next slide. So this is a high generalization of, sort of the difference between annual events and major gifts. And I put this in here for you all to look back at, just to remind you that, for major gifts, you do have to think strategically about how you're going to engage with those individuals and how you're going to employ your team, and probably some leadership on your team and at the hospital to cultivate those individuals. Annual events provide a great source of annual operating income. Typically, major donors like to see, very, very specific impact. And so, you have naming opportunities. If it's a new building, you've got opportunities to really give them the chance to step up and show off their philanthropic intent. But this is a great slide just as a segue to Nate and Lisa's conversation. So I'll wrap up in the next slide with just a couple of thoughts about how I tend to recommend our clients and organizations that we work with to think about their first steps towards a paradigm shift to major gift fundraising. Depending on how big your staff is, sometimes the development assessment can be a really great first step, because it helps you engage an outside person and look at your big picture priorities and the way that you're investing your time. And it provides your board with some recommendations about how you can change your culture to a major gift fundraising culture. And then I am just a really big fan of planning. And so I think that developing a fundraising plan is hugely important. And also tight strategies for your top 25 donors and prospects that you've identified who could make larger gifts is really, really key to success. If you do have an opportunity for a feasibility study that's tied to a potential campaign, I think that that's also a really good way for you to be able to hear from your donor base and find out what their interests are and what their capacity is or inclination to give. And then major gift training for your staff and for your board is always just a great thing to do. Throughout my 25 years, my teams have gone through lots of major gift training, and it really does help you develop a culture of philanthropy across your organization that focuses on major gifts. And it helps your board realize how they can be just hugely essential to the tactics that you employ around major gift fundraising. So that's it. Thank you so much, and I hope there are a few questions, but I'll stop now and see if there are any questions.
Amy, we'll transition this. We'll answer our questions at the end of the webinar. We'll transition it to Lisa and Nate for now.
Great. Thank you all so much, and looking forward to Lisa.
Hello, everyone. Nate Lowry here, CEO of Valleywise Health Foundation. Can everyone hear me okay?
Yes, we can.
Perfect. So we can go to the next slide. I think when we think about essential hospitals in America right now, we certainly think about grit and resiliency, and we all know that there's somewhere right now there's a little girl shivering while waiting for an X-ray, a mother that's waiting in the waiting room for her, and a nurse that's is having to deal with the stress of that. But oftentimes what we don't think about are all of us that are taking on the responsibility of and fund some of the things that those folks need. And so I just commend all of you for all the work that you do and being here with us today. And certainly I'm very humbled to be sharing a little bit of what we're up to, and hope that it can provide maybe just one person with any kind of idea or a little glimpse of hope. So our mission is provide exceptional care without exception, every patient, every time. And when our foundation team took over in 2015, one of the most important things was renewing the partnership with the hospital and our healthcare system. And then the other thing that I think is pertinent today to today's discussion was renewing the conversation of leadership and teams from the perspective of building our board, building our staff, and then building the relationship with our healthcare system so that we could all go together forward. And, I think in the last few months, we've proved that everything that we've done in the last few years to build those things has really helped us from a grit and resiliency standpoint to weather this storm. So I'd say if there's one thing that I can hopefully leave with everyone today, it's the focus on leadership and building great teams. We happened to be just launching our comprehensive campaign in January, and we had done a lot of the things that Amy talked about, super inspiring over the years to actually build into the campaign and having major gift capacity and a focus on it. And that's when, the conversations about COVID started. It was actually March 11th. We were 2 days out from a golf tournament that happened to be on lucky Friday the 13th, when we sat down as a team and just decided actually to cancel our golf tournament. But we started having conversations about what do we do for one of our new signature events, which is called Night of Heroes. And we transition into the next slide, please. So I gathered our leadership team on our foundation, and I think, one of the questions that I ask a lot now, I use the acronym WIN, what's important now? And I just asked that of the team. And for about an hour, we talked about what were the most important priorities for us to work on. And I actually pulled up my notes from that day. And it came down to three things. We needed a testimonial plan for our board and cabinet to launch on social media. Number two was I wanted options and resources for leading the nonprofit industry with a virtual event, which was for our Night of Heroes. And then we needed to prepare for our next board meeting, and I thought what was most important was to show that our staff is leading with new innovative fundraising strategies so that the board and cabinet would buy into everything that we were doing and this new virtual or digital event. And you see some of the questions there, and those are, I think, what's going through a lot of people's minds, and I keep hearing a lot of folks focused on how scary things are or how the market's going to get more competitive or that that there isn't money out there. And I challenged our team to take a very different approach and start talking about where are the opportunities. And if we went hard right now when things are hard, what could we get done? And Lisa and I actually were lucky enough to be on a different webinar that talked about, during 9/11, you saw a lot of foundations that had to do with, say, first responders and that kind of thing, saw an actual rise in fundraising. And so we decided that for us and for healthcare, the time is now for us, and especially for a lot of our essential hospitals that I think are like us in that we've been kind of just humbly working along without a lot of people paying attention to what we're doing. Now is maybe the best time, like the biggest blessing we could have ever had to move forward confidently. If you could go to the next slide. So here is in asking our team to really lead with this and show our board that we were confident. Here were some of the things that were discussed. And thankfully, within the relationship we had built with our healthcare system and some of the things that they saw important to fund was our ability to leverage technology and kind of digital media. We saw for ourselves, being in the 5th largest city in the country and having at the time a very, very small staff, there were 3 of us full time, and then we had a part-time kind of CFO accountant, that we really needed to use technology to be able to scale our message. So thankfully, we had already started to build our marketing team and add some digital capacity to help us launch this. But the team went out and secured other professionals in our market to help us do this. And you can see some of the things here that we focused on. But really, it came back to team and then leadership. Every person on the team was talking about where we were going and what we were going to get done. You can go to the next slide. One of the other big things that helped us a lot was our fundraising platform. We learned a lot. We pulled this event off in 3 weeks, and there were some things that there were definitely some hiccups. There were some things on the website that we didn't have time to recode. But I would say for everyone, the most important thing is to think about a boundaryless transaction. So if you think about like Google and Apple, one of the reasons that they got way out in front of everyone is that they were able to store your credit cards. Now, I know that as nonprofits, we may not be able to do that, but the easier it is for the person to hit buy now or donate now, regardless of what industry you're in, you have to make it easy for folks. And we learned a lot as far as how to make the platform even easier as we move forward. The other thing that this helped us do, for the first time, we had a little bit of competition, which actually our board and our donors really liked. So with that, I hope I've been respectful of our time. I tried to move quickly there. And I think, speaking of teams and leadership, I'd like to introduce Lisa Hartsock. She's been wonderful for us in connecting our message to the impact and what will really touch people's hearts and minds so they donate and get involved.
Thank you, Nate. You can go to the next slide. So what were the results? $225,000 were raised, a wonderful increase over previous years. But even better news is the reduction in the cost to raise a dollar. It went down from 50 cents to 24 cents this year. 188 new donors. The facility that we had for the original event, the Phoenix Art Museum Theater, had a maximum capacity of 300. But with this digital virtual event, our foundation had more than 1,000 views on YouTube. Our Isabella film had nearly 1,700 views and 3,400 plus website page views on the event day. So we had viewers from Phoenix, we had viewers from the West Coast, the East Coast, and even London. Next slide. So what are the research-based principles of giving that were applied to Night of Heroes? Providing a personal story versus a general need or too much data. There's definitely a strategy behind how the event story or feature is selected. This year's story rested on the shoulders of a now 10-year-old little girl, Isabella. With the way our story was filmed, you almost feel like you're living in the moment with her family, and our world-renowned burn team. Number 2, giving is a social act. Studies show alums give more significantly to the university if asked by a former roommate or classmate, or even a current student studying the same field as the donor. Another social component that plays out in research and our event was when our viewers saw others give, they gave. When our viewers saw others give more significant gifts, they gave more significant gifts. And you saw a little bit about the funding platform. Our foundation used a model of teams to organize the event. The teams were led by sponsors, board members, and foundation staff. They reached out to their networks. and built their team. And that started the competition right from the very beginning. The teams also created donor pages, and they had personal photos uploaded on those donor pages. This socially bonded the team and encouraged others to join. And then the words we use, our choice of words used in campaigns, appeals, and events can greatly increase the chance of success. Research into the psychology of giving shows that women increase their giving by 10% when adjectives typically used describing a moral person are evoked: kind, caring, compassionate, honest. The foundation event team names: Team Courage, Team Compassion, Team Heart, Team Positivity, Team Gratitude, and others. And then the last principle is impulse giving. Many givers act on impulse. A significant portion of donations come from impulse donors responding quickly to feelings out of generosity. These acts provide emotional satisfaction. My own daughter impulsively gave as the MC did shout-outs to the givers about their donations. The live program went back and forth between the MC and scrolling team members' personal pages, that social connection again. The ways to give supported impulse giving. So simple. Text to give. Click a button on the computer to give. You know, it's almost like impulse shopping through those unlimited apps at our fingertips now. All the while, the MC continued the important messaging by describing the specific needs that this funding would support, either for our health system's COVID emergency relief or for our new burn center. Next slide. Our timing, April 23rd, turned out to be ideal for our Arizona communities. We've been on shelter in place, like Nate said, for several weeks by the time the event happened, but we still were expecting the surge of hospital cases. Our families, neighbors, and friends were needing some feeling of connectedness. We strengthened our community that night. We enabled our community to come together safely without physically coming together. One donor said, "I felt so good. I felt as if I was part of something again." Another shared, "I woke up inspired to do something because last night I finally felt connected and alive." Next slide. It's an honor to share these lessons learned with you, our fellow AEH members. Please take an opportunity to do something important for your foundation, your health system, and your community. Number one, watch Isabella, the short film. The link's here in our presentation. Number two, watch our event in its entirety. The link is also here. Learn from it, see what you like, replicate the strategies that work, identify where we could have done better, and improve upon it, as we know our safety net hospital systems are counting on us. Thank you.
Thank you, Lisa. Now it's time for the Q&A portion of today's webinar. If you have a question, please use the raise your hand function to let me know to unmute your line and announce you. As I mentioned at the start of the call, you also may use the chat function to ask a question. We do have one question here this one is for Amy. Amy, this question states, what is the average or range of cost to research and launch a capital campaign?
That's a great question. I think that I will say this, that most capital campaigns they tend to be born on the back of a feasibility study. I mentioned that at the end of my presentation. And that typically entails a set of interviews. You develop sort of a case statement or a case capsule, I call them, just a draft case statement to take to a targeted number of donors that are interviewed. And then you take that data and you create a document that recommends whether or not the timing is right, it's feasible to move forward or not. And the cost of that can range anywhere from, a small feasibility study can be as inexpensive as $30,000. I personally have spent as much as $250,000 on a feasibility study for a really large organization. So it just depends. But when I think of research for a capital campaign, that's really the form of research that is the best practice to move forward with. I don't know if I mentioned this, but we did not do a feasibility study for our campaign with Salinas, and the reason was really that Niemand had done a set of interviews through a brand process with the foundation about a year before we decided to move forward on the campaign. And after looking at our donor base and some of the responses from those brand interviews, we decided to skip the feasibility process. But it really does depend. It depends on how many donors you might have or how big the organization is. Hope that helps.
Great. Thank you, Amy. We have another question here. This question is for the Valleywise team. And the question states, now that your gala is done, how will you continue to engage attendees and new donors?
Lisa, Lisa's definitely our moves management expert. I bet she could answer that more eloquently than I can.
It's been really good for Nate's team to have all this influx of people that are some new to the system, some just continued supporters, and needing, like I said, that connectiveness, that it's almost as if our health system, and that's kind of my role to provide information, on us to the foundation. It's almost like we can't keep up with what they're asking for so that they can continue with their touches. We had a call yesterday even, and one of the development officers said, yes, I already shared that last week. What can I share this week? So I think it's just strengthened their moves management component. I think, I think if other systems have backed away and not kept that communication going, I think they're doing a real disservice to their foundation and to their health system.
I think in addition to that, all of that absolutely, and also to Amy's point of using our base manager to go through the process of wealth screening and then running the names of new donors through our board, obviously not their data, but just their names, know who invited who. The other thing with hosting digitally, we were able to, get their email addresses. So now we're looking for other touch points and what messaging do we do in follow-up. To Lisa's point, we're having active conversations about what's next. What's most important to get out to them now, considering the landscape of everything that's going on. So it's a moving conversation. Part of it is systems that we have in place, and then part of it is also just, kind of looking at our local landscape and then the healthcare landscape, and creating strategies in concert with everything that's going on.
Great, thank you both. And on that note, we have another question here submitted through chat for you, Lisa and Nate. It was the current COVID-19 pandemic any part of the Night of Heroes?
So, Lisa, jump in here and correct me as much as you'd like. So where we got a little bit caught was that because our Night of Heroes relies heavily on video, we had already pre-produced all those, and they were geared towards really showing this special little girl, Isabella. She was our hero and our burn center. But the way that we were able to pivot a little bit was to recognize the importance of what we do in teaching and how that empowers our community to be more resilient in the face of any critical nature, and the pandemic being one of them. So we definitely brought it up quite a bit through the evening.
Great. Thank you, Nate. We have a question here for you, Amy. This question is, do you have any best practices for identifying or sourcing leads for likely major gift donors?
I'm sorry, for identifying or sourcing what?
Leads for likely major gift donors.
Yes, yeah. I do. I tend to, well, as you know, as Nate and Lisa said just now with respect to their event, the best way to source your potential prospects for a major gift are through your existing file. And I mean those donors that have given smaller gifts, either at an event like the one that we have been talking about, or just, annual giving opportunities. But doing well screens on your existing file is always the best place to start, and looking at those donors who have been generous for consecutive, year over year. They say, for instance, for a planned gift, which we haven't touched on in this webinar, but they say that a donor who gives you a gift 13 times, I don't know why that's a magic number, but if they make a gift for 13 separate occasions, that they are likely to be very open to including you in their estate planning. So, the donors that you have are the best ones. In terms of researching new prospects, I do that all the time. And I tend to like to use research firms now that I'm a consultant. When I worked in-house, we actually had in-house research services. But, you can find out, it's a little bit scary how much you can find out about people out there. You can really look at giving trends in different sectors and identify donors, within your region that have given to other organizations that have similar missions. And then, as Nate just mentioned, you lean into your strategy and your moves management process, and you try to map your existing organization to that new relationship. But I do tend to like to rely on professional research services, because you can just glean so much about folks that you may not even know about, or that have never even given to your organization before.
Great. Thank you, Amy. I just wanted to give a reminder to our attendees. We have a few minutes left on the webinar. So if you want to ask a question, you may please use the raise your hand function so I know to unmute your line, and I will announce you. We have another question here. This one is for the Valleywise team. This question is, how might you implement a mixed mode for future galas or events with both in-person and virtual programming?
That's an amazing question. Lisa, do you want to take this one?
Well, it's funny because we're already talking about that. We're looking at this fall, and Nate's team, is being very respectful of what's happening on the COVID cases. We saw a spike this weekend. We may have another surge because of the state opening up. So, it's really made Nate and his team talk about what might be a possibility. Is it still digital or virtual, or is there some combination, whether it's entertainment and that's done, in a protective, socially distancing environment, maybe at one of the hotel ballrooms, but you still can have maybe a small in-home gathering and allowing people to participate that way. Nate, did you want to add anything?
The only other thing that I might add that I didn't mention earlier is who are your, I guess, how could I put it? What's the best word? Just who are the people that you want to align with out in the community? And so for Night of Heroes, we had a couple of restaurants that we've worked with before, and they're kind of friends of ours, and the chefs and owners are people that we love. And so without asking them for any money or to underwrite or give any food away, we made them a part of the evening and celebrated, our local restaurants, which at the time were closed down, but to in-house dining. But they delivered food to, quite a few people that wanted to call up and support them by ordering takeout. So I'd say, for these digital events are who are the folks in the community that you can collaborate with and create, win-wins. And that serves the community as a whole as well. It's a way for us to give back, and we're already doing the digital outreach. So why not celebrate some of the companies that we've been involved with, or some of the key board members that maybe own companies, or, any of those kinds of things to, kind of give back in a different way. And I think that creates a bunch of synergy and, just positive energy that helps these digital events, because it really, it almost becomes kind of like no cost. You're doing it anyway, and the technology is so scalable. So why not help get the word out for those folks?
Great. Thank you both. It looks like we have time for just one more question. This one is for the Valleywise team, just submitted through chat. This question is, can you say a bit more about renewing the foundation's partnership with the health system?
Sure. Lisa, do you want to take this one? You'd usually do it in less words than I do.
So the foundation is a separate 501c3, and our health system is a public teaching health system, and foundation has provided funds for a few decades, but it never really got a lot of support, I might say, from our health system. And so about 3 years ago, Nate worked with the hospital leadership, health system leadership, and we developed a cooperative agreement between the two entities, really strengthen the relationship. So, we put it in the slides because we felt it was important that, here we had built so much together, and then this happened, in February, March, and it feels like a setback when in reality, I feel like we have, it's actually been, some positive advancements have happened. So it really is it's really a cooperative agreement that we as a health system support our foundation with an annual amount of funds so that they don't have to worry about raising funds for their salaries and expenses. And in turn, we set up measures collectively that talk about return on investment and cost per dollar raised. And it's worked out fabulously. So that's what the reference was.
Great, thank you both. And now it looks like it's time for the conclusion of our webinar. And that's all the time we had for questions today. Did any of you three have any closing remarks for our group?
Just that I'd be happy to serve anyone in any way I can with any questions or brainstorming, and just a big hats off to everyone for all the hard work they do for our communities across the country.
The same for me. Thank you, Nate. It's been great to be here, and if anyone has additional questions, I'm happy to answer those outside of the webinar. But thank you for all your hard work.
Thank you all. And with that, we will conclude today's webinar. Just a reminder that we have a new COVID-19 email list for members, so please visit the COVID-19 research page of our site to sign up. It's a great way to continue the conversation and ask additional questions related to this webinar. Here is contact information for today's presenters in case we couldn't get to your question today. Also, please keep an eye out for an email from us tomorrow that will contain a link to a brief evaluation form. Please share your thoughts, which can help us to ensure our webinars best meet your needs. The email also will contain a link to a page with the recording of and materials from today's webcast. Thank you again to our speakers and to our audience. Enjoy the rest of your day. Goodbye.